I I was just like, it was a reminder that we're being recorded. Good evening. It's thank you for having me. It's a privilege to be with such an extraordinary group of women. And Chris and I have gotten to know each other quite well at 7 a.m. in the morning, as she has said, which I would love to tell you that's my first meeting of the day, but actually it's not. It's often my second or yeah, usually it's my second or third actually, because I clean out emails. So first of all, I want to thank you for what you do. You know, as residents of a great Commonwealth of Massachusetts, I feel like a lot of the energy I have gotten is by standing on so many other people's shoulders and trying to listen hard to what people's worries are. I'm a worrier, and just trying to use data and not engage polarization of so much that exists in our nation, to provide just real information and to all of us to work through this just unbelievable, hopefully once in our lifetimes, pandemic. So here's where we are today. In many ways, we are, by all metrics, Massachusetts is a national leader, and I wish we were a country, quite honestly. I like to kid my colleagues up in Vermont. I refer to Vermont as, which should be a county. So we are second second only to Vermont in terms of the number of individuals 12 and older. That's the eligible population for vaccines. And on states that are 5 million or more in population, we are the national leader on a per capita basis in terms of vaccine administration and acceptance. And that's thanks to so many people. So to give you the numbers, and I won't blather them all, I promise. As of today's data, 89.3% of Massachusetts eligible people, so that's 12 and older, have received at least one dose, and our fully vaccinated population is just at 78.2%. We provide about 18,000 doses a day. And since boosters rolled out, and I heard a little chatter about boosters, and I'm happy to talk about that, we've administered about 102,000 boosters. Our primary message is to get as many shots in arms as possible. And I use our statistics as a way to assure people how we're doing in Massachusetts, but not to gloat, but to say, you know, we still have 22% of the population that we still need to reach, and to use our success to really lean in even more. And that's very much what we're doing in our equity communities. We're also, but vaccines are the future, right? Vaccines allow us to get on with our lives, whatever our new normal is going to look like, given the fact that at some point the pandemic will morph from a pandemic to an endemic, right? A virus, highly contagious virus that we will manage through vaccines and surveillance testing. We're also, so today actually the Broad, if people know the Broad Institute passed a milestone. We invested in the Broad to be able to step up PCR testing for us in Massachusetts, thinking that we needed more than out-of-state commercial labs. And I know any of you who run a hospital or practices that needed to use out-of-state labs, the lag time from test to test results was in those days quite long. So we invested in the Broad, and today the Broad passed a 15 million milestone in testing in Massachusetts. It's really not about that as much as just having the capacity to provide diagnostic testing for individuals, and we've been implementing surveillance testing through antigen tests, which is not always hasn't been the easiest with our. We actually were ahead of the federal government with some woman by the name of Rochelle Walensky, some of you might know that name, was on the governor's medical advisory board and really encouraging us to get into providing pooled testing and the like. So testing, surveillance, vaccines, and still implementing, reasonable public health measures, we will get through this in our state. I can't hear you. I think you're
muted myself. So that's amazing. So you actually have talked a little bit about the equity and getting to diversity and equity and getting this out to the communities. Can you expand on that a little? And what measures, and I know you're working closely with Kate Walsh from Boston Medical. So what's going on there?
So, we early on, we believe in that government should be advised by other experts. And so early on, we set up a medical advisory board, which, like I said, included people like Rochelle Walensky, who the federal government saw the wisdom to make her our CDC director. And we also created a vaccine advisory board because we wanted individuals from outside of government to also advise us on how to roll out vaccines in this pandemic. And the advisory group had 3 co-equal principles. And we veered a bit and got criticized a bit from folks when we veered a bit from the federal government. So the 3 co-equal principles are save lives, protect our healthcare system, and address equity. And if people roll back a while, you might not want to, so I don't think any of us really want to repeat what we've been through. When we rolled out vaccines early on, we defined healthcare, and Chris will know this. We defined healthcare broadly. Our nurses and physicians, absolutely, right? But we also included dietary, environmental services, parts of our healthcare system that are disproportionately represented by people of color. We added correctional facilities, inmates and staff, homeless shelters, residents and staff, early on in our vaccine rollout, again, with the statement that equity had to be first and foremost. And I can tell you that I received a lot of less than pleasant emails suggesting that inmates and correctional officers should not be before, just name the profession. If you remember when vaccines were limited, but we felt that you had to address equity very early on because of the disproportionality. We added medical conditions that were not on the CDC's list based upon our medical advisory board, as well as our vaccine advisory committee. And I remember standing with the governor at press conferences, and as many of you know, first question out of a reporter is, so why did this federal government say this, and you, state of Massachusetts, are not following the direct CDC guidelines? And we thought that, that was important. We've rolled out about $37 million to 20 communities who've been the most disproportionately impacted, for them to tell us what they need, which is hard for government on occasion. But like, what community do you need to address vaccine hesitancy, vaccine mistrust, and the like? And the numbers are very encouraging, but we obviously have more work to do because you're not going to undo centuries of institutional racism in a pandemic, but you can be very, very deliberative. So equity has always been in the beginning of this on our forefront. It's the only way we're going to see change.
And I think the outreach that you've had in a very collaborative way has really helped to hit pockets of our citizens that we normally wouldn't have. And I do think that's why the numbers are so great. So Do you expect, this is a question we just got, do you expect the antiviral from Merck to be a game changer, especially internationally?
I do. It's first of all, if everyone just pauses for a second and think of where we were 24 months ago, or almost 24 months ago, and the fact that we have 3 vaccines available in the United States with emergency authorization and one FDA approved, and how the science and the biotech community came together and really set aside their competitiveness for a common goal, right? Manage COVID, right? Vaccines for COVID, safe vaccines for COVID, and is really extraordinary. And the fact that the Merck antiviral pill, I think, will be a game changer once it goes through its authorization. You know, I'm one of those people, though, Chris. It's given this pandemic, the proof is in the pudding, if you would. Like, I will wait to see how the authorization goes through, because one of the places where the United States is really behind is in the use of antigen tests that are widely available in Europe for basically $1 a test or free. Is something that we need to really work through the FDA and the CDC process. You know, the fact that we made that the PCR test is the gold standard, and it is for diagnostic, but not for surveillance. I mean, antigen tests, right? Pool tests, that's surveillance. And there are some things where the United States can learn from other countries on how to make available very effective surveillance tests for all of us to be able to open our businesses, get on with life, manage a highly contagious virus without sort of having to shut down our lives, our economies, with all the effects that it has. So there's still some things we need to do in the United States of learning from some other countries.
So I hope that that we'll be open to doing that, because I can tell you the cost of a test now, if you can't get it at a free location, is quite pricey. I happened to drop my daughter off who's going back to college, and there was a CIC, it said testing, $80, a pop. And so that for some people is prohibitive. So I hope that we do advance in that area. So just to shift gears a little, one of the things I know that's near and dear to your heart, well before the pandemic, was mental health and behavioral health. And, it's very clear that throughout the pandemic, the mental health, especially of children, has suffered. And, you've been at the forefront clearly of some of the strategies for developing more beds, and also for many adults, they've suffered. Do you want to share with us a little bit about, what you're doing and how you're helping to address this very, pressing problem?
Thank you. There's no question that the effects of the pandemic have had a negative impact on a lot of people's emotional health. Whether it tested people's resilience, for people who have strong resilience, for people who are fragile, the effects on their mental health are more profound, and just the effects of social isolation, right? The lack of contact. I mean, I'm sure all of us are just zoomed out. But on a more serious note, social isolation, post-traumatic stress, depression, anxiety, phobias, and the like. We will, once the virus is an endemic, we will be experiencing the effects of people's emotional health, I think, for a number of years to come. And I don't say that in a dramatic way. I just think the effects of what is, 20 some months and later will have. During that, and Chris will remember, in the very early days, and others who were in hospitals, in the very early days, I remember Kate Walsh said this, the emergency rooms were silent. there was no one in emergency rooms in those very early days. People afraid to go to hospital. People only coming if they were, transported by emergency room, delaying care and the like. And then as the pandemic wore on, the effects on people's mental health, if people had delayed treatment and the like, really like the acute exacerbation. A good thing that we did, so Massachusetts is probably the incubator of telehealth in the United States, and we were a slow adopter in telehealth. And literally, I remember the public health order and the governor's order, like one day we didn't have massive telehealth, and the next day we implemented telehealth in the Commonwealth of Massachusetts. I'd like to think we could have done it a little bit more gradually, but it worked. And there's no question telebehavioral health for many people has been a lifesaver. We took a broad definition of telehealth, again, controversial for some, where, again, trying to address equity. Not everyone has access to a computer to have privacy and the like. So we allowed telephone access. So we tried to take as broad a definition of telehealth during the public health emergency as possible. We also, and again, if this is too wonky, I can move on. We also paid telehealth as we did for in-person visits, because we didn't want to connote that it was something less than like a lesser service, that it was important. We've maintained that for telebehavioral health in perpetuity, and for primary care for several years going forward once the state of emergency was up. So that has been a lifeline, and I've heard that from many people, that having access to telebehavioral health in particular has been a lifeline. We had an emerging psychiatric access issue. We've had a longstanding access issue, particularly for individuals with Medicaid. Although Medicaid, actually, believe it or not, was actually a better provider of behavioral health service than a lot of commercial plans. We may not pay, but we had a broader array of services for individuals than some commercial plans. But in 2000, pre-pandemic, listening to a lot of families in particular, I'm a social worker, so we went out and listened, put together a roadmap, a blueprint for, think of the ambulatory side of behavioral health, not the entire system, easier access for families, 24/7. We don't have behavioral health urgent care. So creating behavioral health urgent care, creating diversions from emergency rooms. Not that we don't want people to go to emergency rooms, but aren't there some steps before then, before you have a crisis? So trying to open up that front door. Obviously payment, investing in the workforce is a big part of this. Investing in social workers, which I am one, I admit to that. Social workers, psychologists, and creating pathways for people. The planning got interrupted by a pandemic, and we are back at it. But in the interim, last year, put out a proposal to hospitals, an incentive that we would pay development costs on the public side if hospitals could accelerate opening psychiatric inpatient capacity to deal with the emergency department boarding. So BMC, McLean, once I start naming, I'm going to forget somebody, but BMC, Boston Children's Hospital, Mass General, Brigham, Anna Jakes, South Coast, Bay State, UMass Worcester, I know I'm going to forget somebody, have all been accelerating the development of psychiatric beds. That's the good news. The challenge is everyone is facing a workforce shortage. So on any given day, there's probably 400 psychiatric beds that are licensed, but are not able to be utilized because of staff, staff vacancies and the like. So we're trying to work through those with our colleagues in the healthcare industry. But the idea is to really open up earlier access for individuals to be able to get culturally responsive behavioral health services rather than waiting until the crisis is such that you have to call 911 and you end up in an emergency room. We start to roll this out in a pretty aggressive way later this, I live in quarters, so the second quarter of this fiscal year, with what we're calling sort of community behavioral health centers. And again, think of this as sort of an amalgam of really just opening up access to families. So it's a long time in coming.
That's a lot. That's a lot to unpack. I mean, you've touched on so many great topics there, and it's clear the state is putting its money where its mouth is in terms of expanding and trying to create these centers, especially where they're needed and especially in underserved areas. You mentioned telehealth, and that's something that I know in my own hospital, we planned to do it for 3 years and it had no traction. In 2 weeks, it took off, and now the physicians don't want to give it up. So it really is kind of amazing the things that you're forced to do. In some areas though, Secretary, they don't have access to broadband. So, in certain communities, is there any efforts underway through the state level of trying to work to get some of these services to certain communities?
So the state actually does have a goal of having the state to be broadband friendly. Again, some of this got interrupted. And I don't say that as an excuse. Some of this got interrupted like by the pandemic. There's much better broadband access, but it's not universal. And that is one of Governor Baker's and Lieutenant Governor's goal, is to have broadband access in the Commonwealth of Massachusetts. But it was amazing, right, Chris? I mean,
yeah.
There had been a lot of planning on telehealth, and then just
it became the way of doing business. It really did. Just like Zoom for all of us is, now a part of our life when we're Zooming and Googling. I remember that word Google, and I was thinking, wow, it's not just looking it up on the internet, but it became a verb. And as Zooming has become
Zooming, right.
Yeah. We're all Zooming. What about screen time? So for those kids who are in school or aren't in school because there's COVID cases, there seems to be a lot more screen time. And, I think we read everywhere about the deleterious effects of screen time. Any thoughts or comments on that? Any suggestions or?
So the closure of schools, I think, whenever anyone sort of rewinds and we all do massive after action on COVID, which we will do. I think the fact that we could not keep schools open for kids is something that I think about a lot, and the effects of not being able to keep kids in school is just one of those, a tragedy of a pandemic. The effects of schools being closed, particularly for kids for whom, and I'll just give you a little anecdote. So I have a niece who is a special education teacher, not in Massachusetts. And for kids for whom their attention span is such that Zoom, remote learning is really just not possible. And where she teaches, and she's exactly who all of us would want as a special education teacher. She is like 250% every day with her kids. And she did actually, so her school shut down. She couldn't do for almost the entire year. And she actually went around to each child's house with their parents, gave lesson plans because they could not participate in Zooming. And I think particularly for kids for whom some special ed kids, all kids lost, I don't know, some amount of learning time, as we all know, but kids for whom really were being remote and having to learn through Zooming and the like just really has not been effective for them. So I'm getting to your question, but we're really committed to keeping schools open. This is why we rolled out with some growing pains, probably it is the most aggressive pool testing program in the United States. and a test and stay program so that kids could stay in school. And it was great to hear today on the governor's call that the CDC is going to come out with their guidelines for test and stay in the next few weeks. And we already started to roll it out. So that really is our way of getting teachers vaccinated, of keeping kids in school. I do think, having people interaction time again is really important, and having kids be able to be kids, which is why, and I know, there's lots of opinions about masks, not masks. I didn't realize that mask became a 4-letter word during a pandemic, but it's definitely a third rail for many people. But trying to get kids back into doing sports or recreation or after school, and being with their families again, and just turning off the computers is important for all of us. We put out some messaging. I don't know how well we have done on that around, in-person interactions and not just the screen time, because I do think there's gonna be a whole generation of kids who only know Zooming, I think. And I don't mean that in a very positive way, but the social interactions and the developmental skills that I think kids are going to need to learn again. That's a little bit of a ramble, but happy to go into some more about that.
No, good one. So I had the Joint Commission today at my place, but we're doing a mock survey in preparation for our regular survey. So as part of the opening statement, they want you to sort of recount the things you've done since the last survey. Well, all we've done really is deal with the pandemic. But as I was putting the slides together over the weekend, it really jarred some of my emotion and some of the early days when we just didn't know what was happening. So one of the questions we have sort of reminded me to ask you, do you have any memorable moments or any moments of truth that you'll probably hold with you forever as you've gone through the last 24 months?
Well, let me give you a positive one. A positive one was the moment, and I'm not saying this because Chris is interviewing me. We are lucky in the Commonwealth of Massachusetts, where healthcare is a very dominant industry. It's also a highly competitive industry. And during the early days of the pandemic, and when we're coming together to set up sort of our first field hospital, I came to realize that our highly competitive healthcare system was operating as a unified, collaborative healthcare community. It was extraordinary. And Chris will remember this, in those early days, there would be these constant phone calls, and all of us, it was like this early assault, and hundreds and hundreds of people coming to the hospital with COVID. And I remember Emerson Hospital, we were on these phone calls, and there was a hospital south of the city that their emergency room was feeling like really under siege. And hospital CEOs, I'm going to have my chief nursing officer is going to call your chief nursing officer, and we're going to take the transfers from your hospital to ours. We're going to redirect the ambulances. We're going to take people from your emergency room. No one worried about insurance. No one worried about whether the patient was in their network or not. It was literally about saving lives, protecting the healthcare system. And it was, that was a moment where I came to understand that we would be stretched, but our healthcare system for the residents of the Commonwealth would never be overwhelmed. And we set up 5 field hospitals, only used 3. I'm sure that will be an auditor's delight when they come and ask, like, why did you set up 5? Because we didn't know. And hospitals, Boston Children's Hospital, for example, had ventilators. And, in the first surge, children were not really affected, not like older adults and the like. And Boston Children's Hospital literally lending ventilators to other states as we were waiting for supplies from the federal government. I mean, that was really, and And then we went back to being a little bit more competitive again. But and that's just something that, some people may say, well, of course they should act that way. But that's not what happened in other states, in some other states. We went through the painful process of putting together crisis standards of care. And I remember thinking, I can't even believe that in a state like Massachusetts or in our country that we're having conversations about rationing healthcare during a pandemic, and then realizing like we will never have to implement that here in Massachusetts because of the strength of our healthcare system. So that was truly that was a day when I felt like I could breathe. Like I was like, okay, we will work this through together. And then, obviously there are moments. So for 5 months I had state police protection. And that was one of those dark times, when you realize, that the polarization or the fear was such that I had become sort of a lightning rod. So those are examples of, sort of a moment where I felt like, yep, this Massachusetts is where I'm glad that I'm a resident. And then sort of, when you realize not everyone appreciates public officials.
Well, I could say from the healthcare community, it, continues to be a great partnership, and we don't feel alone. There's always tension, I think, sometimes between hospitals and government over the years, and that really melted away. And, I think we're all excited to keep that moving forward. But you brought up something about children and Children's Hospital. And one of our questions is that the Delta variant has led to increased infection rates among children not vaccine eligible. Can you discuss any issues parents with children under 5 are facing, and do you have any advice for them?
So the promising news is that probably by the end of October, I'm anchoring to November 1st, just because it's that we will have the Pfizer vaccine should receive the emergency use authorization for 5 to 11-year-olds, and in Massachusetts, that's about 515,000 of the 845,000 children between the ages of 0 and 11. And so that's promising, and we're pretty ready with about 700 locations, primary care practices, and the like for once it is authorized. And for younger kids, the data would suggest that while younger kids will become infected, they don't seem to get as ill as adults and the like. And so that's sort of data that the Department of Public Health and others, and actually was one of the questions we asked the CDC today, was to put out more of the information about 0 to 5-year-olds, because I'm going to be surprised if the 0 to 5-year-olds anytime soon there will be an authorization for vaccines. So we really are relying on the CDC to put out the information so that we can put it out then in the public. And how do you keep your kids safe and the like? Because we're not going to eradicate this virus. I would love it if we were. And these vaccines are highly effective for serious illness and certainly death. But we will be learning how to manage this. And if I could just give you one other good data point, since I live in the world of data these days, there's a lot of talk about the breakthrough cases, which is actually a term I don't really like, but I didn't name it. So for individuals, so this is Massachusetts data. So if you've been fully vaccinated and then, contract COVID, the likelihood of you, hospitalization rate is 0.03%. And the death rate of individuals who are fully vaccinated, who then are infected with COVID, is 0.006%. And this is data as of October 2nd. So the data then was of the 4.6 million people fully vaccinated in Massachusetts, 300 people who've been fully vaccinated died from COVID. The numbers, if you're not vaccinated, so what we now have is a pandemic of the unvaccinated. It's like 5 times the likelihood that you would be hospitalized and about 6 times the rate you would die. So just give you a, I'm trying to make you all vaccine ambassadors for me.
Well, if you are unfortunate enough to, especially with the crazy Delta variant that's been going around, to contract COVID, we've seen that there's been efforts in other states, like Florida, to offer monoclonal antibody treatments at some walk-in sites. And so I think that we have them in Cape Cod and Worcester maybe now. I know actually we also do it at Emerson. But what are your thoughts on that? And should it be more widely available? Is there going to be a mass monoclonal antibody, center, or what are your thoughts on that treatment?
So we are not doing mass sites. I know they were, our mass vaccination sites for some people were controversial. On the other hand, we were able to vaccinate 1.8 million people in Massachusetts. So I'm happy to live with that controversy on mass vaccination sites. But on monoclonal antibody treatment, so 7 states have utilized 70% of the available monoclonal antibody. And Massachusetts was not as quick adopter as hospitals as 7 states in the United States that have accounted for 70%. We use monoclonal antibody a lot in our nursing homes when we have a COVID breakout. And we have 60 rapid response. I put together a rapid response team for nursing homes when we all saw that, how devastating the virus was in nursing homes. And it's, 2/3 of our deaths have happened in long-term care facilities, which is pretty much true nationally. So I put together a rapid response team for nursing homes, first to help provide clinical coverage if there was a cluster that happened in a nursing home. And now we're using the rapid response team. These are all nurses for monoclonal antibody treatment, infusion therapy to help manage a breakout. And we have entered into a contract in the state with, you actually described it well, Chris, with a company that sets up for hospitals the infusion therapy. And I think we've signed up 3 in the past. I think it's Worcester. You actually said 2 of them, and the third one is Bay State. So I do think we are promoting this. There is not as much monoclonal antibody treatments around. It's all controlled by the federal government. So we have to request a supply through the federal government, which we are doing.
Oh, good. So we're in the game. Yeah,
absolutely.
Yeah. Is there any data on which vaccine has the highest breakthrough rate? Does the state keep information on that, or?
We don't. The CDC does. They're actually all fairly equivalent in terms of the percentage of breakthrough cases.
Okay, so that's interesting to know. Another thing was around the Boston Public Schools, and do they track and keep data about cases? Because sometimes I think if you go on their website, it says 0, but kind of anecdotally here. So folks were kind of wondering, is that a system that's under review or in the process of being rejiggered, or?
So in the spring, when schools reopened, schools self-reported. So this is self-reporting data. And so I'm sure if there's some epidemiologists in this group, you're probably, your hair is sort of standing up on the back of your neck. So this, so all schools are required to report self-reported data, as well as for childcare, that is reported weekly on the state's website. So there's an error rate with self-reported data, But again, we thought it was important to like put the data out, and then it's a pandemic. It's not going to be perfect. And then you keep refining. And then when we thought before Delta, all of us may remember we had like a little lull, May, June, thinking life was coming back to some sense of normal. We took down a bunch of data. We took down, schools were closed, so we weren't reporting that data anymore. And then in September, have the schools, once schools reopened, have schools self-report the data again. It is self-reported data. The Department of Elementary and Secondary Education does contact the schools around, the reporting of the data, but it is dependent on the schools for reporting. We match it in the Department of Public Health with like what we see through clusters and other data, is to try to match it along with the pooled testing data. So it's a little bit of a triangulation of different data sources. But again, I think despite the, there's always someone who says you're not reporting right or whatever. But we try to put the data out there for the public to have and to ask the questions.
Yeah, and I think we've relied and we've used that data. I know every time I report to my board, I'm getting the data from the website, and appreciate that it's there just to keep people sort of in the loop. And what about vaccine effectiveness? It does wane over time. And does the state track this by age group? Do you have any recommendations? Should we all run out to CVS, Walgreens, and Shaw's? And, if our 6-month mark is hit, what are your suggestions?
So we do say, we do follow CDC guidelines on this. If you are, we didn't have a big uptick on in August when the people who were immunocompromised could get Pfizer, Moderna third doses. Massachusetts didn't have a big uptick on that. It was we estimated about 110,000 individuals were eligible, and the numbers were modest in comparison. Once I thought there was going to be 110,000 people were going to go get third doses, but that was not our experience. It was probably about 40,000 people, if I remember the data correctly. We are seeing a healthy uptake of individuals over the age of 65, and 73% of the people who've gotten boosters are over the age of 65 on their 6-month mark. This is a self-attestation. Again, it's the question we are always asked: is someone going to race to the front of the line? And I think as we have experienced this pandemic together, we believe in we write policies for reasonable people and then deal with the outliers. That's really how we have tried to manage this pandemic. Like I can't write a policy or roll out a process for every contingency. So we try, the governor and I are very clear about this. We try to write the protocols for reasonable people and then manage, like I said, the outliers. So it's a self-attestation. I have heard there have been a few people who have thought that they're immunocompromised and gotten their third doses with Pfizer. So be it. We have plenty of vaccine in the United States and in Massachusetts for people to get their third doses. We are recommending people to get a booster shot, as the CDC has opined on it. I got J&J, so I think I'm at the end of the line on the boosters. But that's really a timing thing. So if people remember again, right, Pfizer was the first one authorized, and then Moderna, and then J&J. And so the authorization for boosters is going through that same timing schedule. But yes, I told my husband, he's turning 65 in a few weeks. My birthday gift to him is he will be eligible for his booster shot.
It's a good gift to have. Keep him around for a while. So, given that some people may have to wait for this, what are your thoughts on at-home testing, COVID testing kits? There's One Call, Quick View, and I'm sure there's others, but folks are curious about your thoughts on that.
I I think the future is surveillance testing. The governor is very much advocating for the federal government to follow what has happened in Europe and in Israel, of having free or very low cost surveillance at home kits for families, for anyone, for households. I have a couple of boxes of one of them at home as well, and you know, I have used them on occasion. I think it's a safety. I'm a believer in surveillance testing to manage a virus. So I'm not here to endorse any one particular product, as long as it has its EUA. And you know, there are 6. I think personally, what's frustrating to me is there are 6 $1 tests available in Europe through their authorization process that have not yet been authorized in the United States. And I think that would be a measure of safety and comfort for a lot of people. And so we would like to get at-home tests available for people.
So, which is great, you know, and everyone probably should have one in their medicine cabinet. And, you know, there is some, if you look at the research in the UK, if you got J&J, they tell you to get Moderna. If you got Moderna, they tell you to. Any thoughts on that for us?
So this is where we really need guidance from the federal government. I mean, so they are taking up what's called mix and match. When the governor and I don't know, sometime this summer, when we went to visit the Moderna manufacturing in Norwood, Massachusetts, the head of Moderna, actually the chief scientist, was saying, you know, there's a lot, their studies were suggesting that mix and matching would actually be protective for individuals. And I think there was some individuals this weekend or today talking about mix and match, what's called mix and matching. And the CDC and the FDA are taking that up as part of the Pfizer and the Moderna and the J&J booster conversations. And it's called mix and match. So again, that's not my term. It's and we'll see what they come out with. But I do not try to opine what the scientists are going to do. I will take what the guidance is and then figure out how we implement it here in the state.
So through this last 22 months, many of us had to worry about, you know, our families and our workforces and, you know, as leaders. But in order to take care of your workplace and your family, you have to take care of yourself. And, you know, I've always been completely amazed at how you look good at 6:30 in the morning. You remain fashionable, as we see. And so you must have some sort of secret. What do you do to manage your stress? What do you like to do in your downtime that recharges your battery, that allows you to not just take care of your family and one entity, but kind of all of us in Massachusetts?
That's very kind. Do not get your prescription changed anytime soon on how I look. I feel fortunate that the governor has been completely supportive of my work, our work together. He has, you know, and this is not a political statement by any means. It's, I'm not sure neither he nor I appreciated how long the pandemic was going to last. You know, I remember thinking, oh, we'll have the command center for a couple of months. I wish. And how polarized, particularly at the national level for a while, the rhetoric, and just right, it was like no gray. Everything was yes or no. It was just so black and white, and like the rhetoric for a while. So the fact that I felt very supported by the governor, and 24/7 we were on the phone with each other. Some of them were very, you know, intense conversations, because as we were trying to manage our way through something no one's ever really managed before, and realizing early on the states were really left on their own. So one, you need that, because every decision I made had a consequence for someone or a organization or a business or the like. The day I made the decision, it was my decision to stop all visitation for long-term care and congregate care. It was one of a series of, difficult decisions you make. And, and I knew that the governor had my back. And I think you need that during this period. I do often say to people, you're only as good as if you take care of yourself and to take care of others. I'm probably a little bit of a work in progress on that score. But there's two things that I do try to do. Three things. One is I'm graced really with a very supportive spouse. The one who I'm giving his birthday gift is the booster shot. But literally from the moment when I told him I was going to take this role on, he literally just said whatever. He would just take on everything in our personal lives that we had sort of like shared on. And so and he's to this moment, he still does. I could tell you a funny story. When I went down to work out one day, and I try to work out. I used to work out 6 days a week. If I work out now 3 days a week, I'm feeling good. But a few months into the pandemic, I went down to our basement to work out, and I looked over and I noticed that there was I think it's a new washing machine. And I was like, where'd that come from? So I came upstairs. I was like, where'd that come from? And he's like, oh, it's been down there for about 3.5 months. And, I was working out. I was like, just completely oblivious to the fact that I just didn't have to worry about it. So that's one. And when people thank me for my public service, I actually say the person they should thank is the person who was able to absorb a bunch of responsibility in our personal life. My family talk to him. Like I come home and I'll say, how's your day or whatever. And he'll say, oh, I've been on the phone with like my nieces and nephews or somebody. And I'm like, well, why don't they speak to me? And like, because they talk to him. So that's the second. And the third is I try to work out a little bit. And as Chris knows, I'm a baker. And so
finally, I was waiting for you to get there. Were they snickerdoodles or what?
Those were snickerdoodles. So baking has always been a great joy of mine. And if you think about it, it has a beginning, a middle, and an end. And if you do it well, right, it makes some people happy. So I won't tell you what time of the morning I get up. And it's rare these days that I bake, but it is, for me, it's a way to just check out for a short period of time and to try to thank the people who are my supporters in my life with their grace and understanding that they really haven't seen me except on TV or on Zoom for the past 20 whatever months. So that's kind of you to ask.
So you left us with some really great advice. So have a supportive boss who has your back. And if you are a boss, be a supportive boss and have your team's back. Choose wisely and have a supportive spouse or a significant other or a friend group or colleagues, anyone that's close to you that can help you through some of the challenging times. And although you said work out, she looks really great on a paddleboard. So I think getting out of your comfort zone, exercising and trying some new things to alleviate stress and work out. And, as one of our members so aptly said, thank you so much for your time. The last 24 months have really required extraordinary courage and perseverance. And we're immensely grateful to you, your spouse, and your team for all that you've done on behalf of the Commonwealth. And we're so thankful that you could spend an hour with us tonight. And I'd love for everyone to give you a round of applause.
Oh, no, thank you.
And we'll let you go. We know you have other things to do. So thank you and your team so much. And I know I'll be talking to you tomorrow morning.
Tomorrow morning at 7.
Can't wait. And everyone else hang on. We're going to turn it back over to Constance, and she's going to give us an update on the 3 programs we have that will come for the rest of the year. Thank you very much, Secretary.
Take care, everybody. Be well.
Thanks so much. Thanks, Marylou. And thank you also, Chris. Before we talk about what's coming up, I really have to say, because she did not introduce herself, Christine Schuster is president and CEO of Emerson Hospital. She took that position a year after she became a member of the Boston Club. We can't accept credit for that. It's her own skill and past experience that got her that position, but we're proud of her. And thank you so much. You were a terrific moderator. I have a lot of experience these days watching people take chat questions and hand them off, and you did a terrific job with that. So we very much appreciate it. And as Christine mentioned at the beginning, she is part of a group within the Boston Club. Carolyn Langer's also on tonight, and Nancy Nager, the club president, and a group of other women in the club who have come together to put together a series of healthcare events. And we actually have 4 more scheduled coming up on December 14th. There is a program on women's specialty health, and fingers crossed and COVID contingent, that one may be in person. On February 8th, we'll be talking about, and this came up a lot today, technology in healthcare, digital health, wearables, and artificial intelligence in healthcare. On March 29th, we're going to be talking about innovations in women's health. We did a program on innovations in women's health at the beginning of COVID, and it was hugely popular. And I think this time will be even more so. And finally, on May 10th, we're going to talk about healthcare careers, driving your career in healthcare. Where do you want to be? And that one also, we hope, will be in person. Hopefully by May, we'll all be back together again. And before I close, I just have to promote our upcoming corporate salute on November 4th. We do the corporate salute every year in order to recognize and honor New England public companies that have women on their boards of directors. And this year we are extraordinarily pleased and lucky to have Indra Nooyi as our keynote speaker. As you probably know, she's the retired chairperson of PepsiCo. Her latest memoir, My Life, is on every bestseller list, and I think she's been on every television program that's going. But we can tell you that she will speak very closely and very personally to us in a conversation that's being moderated by Shirley Lung of the Boston Globe. So we hope you will all go to thebostonclub.com, register for any of the healthcare events or for the corporate salute. And we also hope you all get boosters. We hope you get your flu shots, and we hope you stay safe and well. And thanks for being with us tonight.